Good morning, everyone. This is Ron Washington, and I'm your program ambassador. And we're glad to have you today. Today, we have June's webinar, and that is equity, with equity in mind, advancing brain health and inclusion in the workplace. Our speaker is Dawn Bunn, and she is the regional director for the Alzheimer's Association and also the executive director for the Tennessee chapter. A little bit about Dawn. She joined the Alzheimer's Association in 2019. She's a regional director also for Tennessee, Alabama, Mississippi, and Louisiana. Her and her team are very passionate about working with corporate sponsors, community groups, and influencers to get out the awareness. And so we appreciate her coming today to spread awareness about this. She also works to promote legislation to support individuals, families, and caregivers with regard to Alzheimer's and dementia. Before joining the Alzheimer's Association, she was a regional director for St. Jude's. She was also a senior director for UNICEF and has been in business development, in advertising and media in DC, Washington, DC, and also New York. She is passionate about global philanthropy and has done work in the Middle East and also Africa. She got her degree from the University of Maryland, and we're lucky that she's in the area. She lives in Franklin with her husband and her daughter. And so I'd like to introduce Dawn Bunn.
Thank you, Ron, so much. Hello, everybody. Thank you so much, Jennifer, as well, and the rest of the committee who organized our chat today. Thank you all so much for inviting the Alzheimer's Association to speak to this group during what we're honoring as Alzheimer's and Brain Awareness Month, but it's also Pride Month. So it's a month where we're talking about brain health, we're talking about equity, and so it's so appropriate, and I'm just so grateful to be here. You know, there's a lot of reasons why we all do what we do, but this mission for me is quite personal. And if you don't mind, I might take a moment to tell you about my mom. My mom is in late stage dementia here in Franklin, Tennessee. I actually saw her this morning. We are probably at the end of our journey. My mom is currently in a nursing facility in Franklin, and she's on hospice. She's in peace and she's comfortable, so we're grateful for that. And I'm just so grateful to have this time with her at the end of her journey. A couple years ago, when my daughter was 10 and we were driving away from visiting my mom, her grandma Kathy, my 10-year-old daughter looked at me and said, "Mom, how old will you be when you get dementia?" So for me, this is a very personal fight. I will continue fighting for treatment, for better testing, for prevention of Alzheimer's and all related dementia, so that my daughter will never be my caregiver. I don't want her to be my caregiver. I want her to just enjoy a normal life with her children, her family, hopefully in the future. And so we fight. And so we'll talk a little bit about the association. We're going to talk a little bit about the disease itself and some innovation and progress that we're making in terms of testing and treatment. I'm going to stop at different times in the presentation. So if you have questions, please feel free to just throw your hand up If you want to turn on your cameras to see me while I'm presenting, that would be great too. But I'm just here to answer as many questions as possible. So obviously this disease, Alzheimer's and related dementia, is making a huge impact in our communities. And when I look at these statistics, every year the Alzheimer's Association releases a report called Facts and Figures. This was very recently released on April 29th. I'm always just so surprised by this number of over 7 million Americans living with the disease. This number has grown from when I started at the organization in 2019, like Ron mentioned. This number was just over 4 million. And so we know that the increase, it's becoming more prevalent. I'm always also impacted by the 12 million caregivers, right? So we know that this disease is so hard on those living with the disease, but the impact on caregivers is immense. As we continue to make progress, we're seeing that 92% of Americans would want medication to slow the progression. We know that 4 in 5 Americans are optimistic about new Alzheimer's treatments. So these are the latest study that we have done on kind of the US's sort of openness to treatment. And when this is one of the most feared diseases in the US. It has a larger impact than breast cancer and prostate cancer alone. So I'll just move forward with a quick video and then we'll jump into more of the talk. All right. So at the Alzheimer's Association, we are leading the way to galvanize the global community, accelerate research. We are the largest nonprofit funder of research for Alzheimer's and all related dementia, but we're also driving early detection and diagnosis. But we need to make sure that we are here for families who need us now, who don't qualify for the new treatment. So we're going to talk about later in the presentation. Our vision is that world without Alzheimer's. So we often get questions regarding the relationship between Alzheimer's and dementia. Dementia is sort of the umbrella of symptoms that affect daily living, and Alzheimer's disease is the most common cause of dementia. There are other types of dementia. My mom has been diagnosed with frontotemporal dementia, but likely has mixed dementia. Mixed dementia is becoming much more prevalent, and that's probably due to improvements with diagnosis. The disease is progressive. At this time, we do have 2 treatments that we'll talk a little bit more about that do slow the progression of the disease just slightly, but it is terminal. There are no cures for Alzheimer's. And as the disease progresses from mild to, I sort of mentioned earlier that my mom is at the end stage, the ability to function and perform daily tasks becomes harder and harder. And some folks lose the ability to speak, the ability to make decisions. So it gets a little bit harder as the disease progresses to care for our loved ones who are living with the disease. Unfortunately, there are populations that are at higher risk, and we talked a little bit about equity earlier. The Black African American community is 2 times more likely to be diagnosed with Alzheimer's, as the Hispanic Latinx community is 1.5 times more likely as well. And women, I see that a lot of us are women on the call today. We sort of, unfortunately, were impacted by the disease, really being, 2/3 of those living with the disease, but also 2/3 of caregivers are women. So we are impacted both as those living with the disease and those caring for our loved ones. Since it is Pride Month, we do want to talk a little bit about the impact of the disease on our LGBTQIA plus community, which the impacts are very unique in this community. From our perspective, we need to ensure that we are reaching as many people as we possibly can from a health equity perspective. We want to ensure that all communities have access to our resources and have access to treatment and testing and other needs that they might have for quality care, and to have the best health and financial outcome as possible. Age is the highest risk factor for Alzheimer's. We will talk later on a little bit about modifiable and non-modifiable risk factors. And right now, we do have an estimated 2.7 million people in the LGBT community over the age of 50. So as people age, they do become more high risk for the disease. And then there's some health disparities that again will impact those modifiable, non-modifiable risk factors. And so, we're seeing about 7.5% of the population that are living with dementia. Again, treatment and testing, so getting that diagnosis can be a challenge sometimes. But something just important for us to note is there are unique challenges with this community. A lot of our LGBTQIA plus community may live alone. And so, when you think about those non-traditional caregivers, it becomes a little bit challenging. It often is family who's caring for their loved one. And unfortunately, they may fear discrimination and may not seek that diagnosis, or there may cause a delay in care. Unfortunately, this is going to slow our ability to, now that we have treatment, to offer those treatments. And so again, just some unique risks, but also some unique sort of impacts of the disease on this community. And I'm happy to answer any questions that you all might have regarding any of these statistics or anything that I've shown so far. Okay, so at the association, we are really trying to work through community partners to reach those communities that are most impacted by the disease. We have national partnerships with Safe Space, with Open and Affirming Coalition, with SAGE, and the HRC Foundation, where we also have a number of other community partners who are reaching diverse communities. When we talk about equity, we want to ensure that all people have access to care, but also the information and the resources available with the Alzheimer's Association. So we talk, we often get questions about, what are those early warning signs for Alzheimer's and dementia, or what is normal aging? And so, here on the slide, you're going to see our 10 warning signs of Alzheimer's. what I always like to share is, listen, we're all going to lose our car or forget where we parked our car when we pull into Target, right? But most of us know how to use the steps of like clicking our clicker to make our horn go off or our lights blink. That helps us find our car. Maybe you think in your head, oh, I remember coming in by Starbucks, and that's, I kind of came in from the right towards Starbucks. And so if you can sort of take those steps or follow the process of finding your car, that's pretty normal for most of us. It's when you can't follow those steps of to actually find your vehicle is when you're really going to be a little bit more concerned. And so again, all of us, we're busy. We maybe don't get enough sleep. We're all working hard, raising a family. And so if you're having a hard time remembering kind of where you were going on I-65, that happens to me. I get off just automatically at my home exit, and I really was supposed to get off at the exit before. Again, we're busy people. That isn't something necessarily to worry about. But it is good to know these 10 early warning signs. And if you're having any concerns about memory, you should always consult a physician. So we've kind of talked about the importance of early detection and diagnosis, but I want to share a little bit more about why. So the earlier we can be diagnosed, the more the better outcomes we're going to have from a health perspective, financial, legal perspective. If you're diagnosed a little bit earlier on in the disease, you're able to make some of these decisions for yourself and what you want your future to look like and what you want your end of life to look like and make those arrangements. But even more important is that we do have 2 FDA approved treatments that address the underlying cause of the disease. So, up until now, we've had treatments that have impacted symptoms. So, they've helped manage symptoms of the disease, but they haven't actually addressed the underlying cause of the disease. So in our brain, 2 hallmarks of Alzheimer's is we have the amyloid plaques and the tau tangles. These 2 new treatments, you'll see them here, Leqembi, they're in sort of a lavender to the left, and Kisunla. Both of these treatments actually are anti-amyloid monoclonal antibodies, and what they do is they sweep the amyloid out of the brain and they actually slow the progression of the disease. What we're seeing with Kisunla, the second treatment, is that those that have been in the phase 3 trials and currently are on these drugs are seeing 0 progression for an entire year. And so if you have a loved one living with this disease, you know how impactful that would be to have no change and no progression for an entire year. Ron, do I need to pause for any questions? Are we seeing any in the chat? Oh, you might be muted, Ron.
Yes, I am muted.
Okay.
Checking the chat. I don't see anything at this point.
Okay. Okay, great. Any questions right now regarding any of the statistics or sort of where we are with treatment
We
or
do
any of
have
those?
one question that says, any reasons why women are more at risk of getting Alzheimer's than men?
So I love that question. Thank you for that question. And there is actually a research study right here at Vanderbilt that is looking at why women are more likely to be diagnosed with Alzheimer's. I think there are some impacts of menopause on women and their cognition. And so, as we kind of flow through this really fun time of our life, menopause impacts cholesterol. It impacts our management of our blood pressure and other health issues. And so they are seeing some impact of menopause. So as women are living longer, there is an impact, unfortunately, on women, but there are a lot of studies looking at why. Just as you might not have a genetic connection within your family, but sometimes the disease is still impacting your family. For instance, my mom and her sister passed away of Alzheimer's 2 summers ago. My mom, as I mentioned, is in late stage of frontal temporal dementia, but there is no family history in our family. So of course our family wants to know why. Why are these two women impacted by these diseases, whereas we can't see a family relationship or a family history? So there are a lot of studies, Jennifer, looking at why women are impacted. Let me pull up any additional questions.
That
Oh,
was Krista's
Oh,
question. There's one more. I put one
yeah.
in the
yeah.
chat too.
Okay, great. I'm seeing. So we're talking about if you genetically test to have the DNA markers for late son. So this is a good question. So there are genetic tests. You're looking for the APOE4 gene. If you have one copy of the APOE4 gene, you have a higher risk, maybe like 5%. If you have 2 copies of the APOE4 gene, you have maybe a 27% of higher risk. I would say it's something you should talk about with your physician, especially if you have concerns regarding your memory. And I think that it probably would make sense to look at some of those modifiable risk factors that I'm going to talk about in just a second, because there are things we can do to keep ourselves healthy. What I will share also is I just came from Washington, D.C., where we had our AIM Advocacy Forum. So we had over 1,100 advocates on Capitol Hill, all dressed in purple, meeting with their legislators and talking about the impact of this disease and the importance of that NIH funding that goes towards research. And the thing that we, are constantly talking about with our legislators is that, we need to continue, we need to lean in now. Now is the time. And at Forum, we learned about, so the 2 manufacturers of Leqembi and Kisunla, it's Eli Lilly and Eisai. They're currently using both of these drugs in a study where they saw using a blood test, which we're very excited to say the FDA just cleared a blood test to determine prevalence for Alzheimer's. And that blood test can be used, but is only marketed right now to those showing symptoms. But they've used the blood test to identify if there's amyloid in the participants of that study before symptoms. And now they're going to test these 2 treatments to see if they start the treatments before symptoms, can they actually prevent symptoms from happening? So for me, I'm very excited because they're now already doing studies to prevent Alzheimer's and related dementia through medication. And we know that there are additional studies about brain health and about those modifiable risk factors. So why don't I jump in there if that's okay? Did I answer the question regarding the genetic test?
Yes, ma'am. Very nice.
Okay, great. So we always need to be thinking about our brain health, and truly heart health is brain health. So all the things that we've kind of always talked about can reduce our risk. That healthy living can reduce our risk for Alzheimer's and related dementia. We mentioned age is the highest risk factor for Alzheimer's. So, and that's something we can't change. We cannot change our genetics. We cannot change our race, our ethnicity, our sex, our gender in this case, where we're looking at sort of those impacts, that sort of non-modifiable risk that we might have for the disease. But there are things we can be paying attention to. So, have you had a traumatic brain injury? Are there environmental factors? That is another number of studies. There are a number of studies out there looking at environmental factors, maybe in our food or just in our community. Are you active? Are you managing your blood pressure properly? Are you eating well? So we lovingly call these our 10 healthy habits for your brain. And so right now we're doing one of them. We're exercising our brain by learning together today about brain health. And so the more we can do to exercise our brain, that is one thing that's going to be really, really helpful. So I've heard learn a new language as you age, learn how to play a musical instrument as you age. Those are things that are going to keep your mind sharp. But there's also other things. So we maybe probably don't all sleep well in our world, right? So that's something we need to be focused on. Are you sleeping well? I think that's one that I always think about. Am I doing, am I getting enough sleep? Are you exercising? And we're not talking like running a marathon. We are talking, are you stretching, creating some type of sort of cardiovascular exercise 3 times a week, at least for 30 minutes? That's something we can all do, right? And so, get up, get moving, get active, control your blood pressure, don't smoke. These are all pretty, you know, easy to understand. But these are the things that we can do to prevent the disease, especially if we are at higher risk, as I am, with family history, or if you potentially have one of the genetic markers for Alzheimer's or related dementia. Okay. We are funding a ton of research here in the state of Tennessee. So, as the largest nonprofit funder of research in the country, some of that funding is coming right back here to the state of Tennessee. We've got studies at the University of Tennessee. We've got studies at Vanderbilt right here in my backyard, and as well as St. Jude Children's Research Hospital. So, we're focused on finding those next treatments, those next innovations, but we're also here to support families who need us today. We have a 24/7 helpline. I often say, if there's nothing else you take away from today's presentation, please take down this 1-800 number. You just never know when you're going to have a neighbor who is really struggling because their loved one is showing early signs or having memory issues, and they're not really sure what to do next, right? One, we always recommend they speak to their physician. Maybe somebody isn't comfortable talking to their physician, so maybe they can talk to a faith leader. We always are looking for other leaders in the community, like all of you. I mean, Sherm, your role as HR professionals, you are leaders in your companies, and we are here to support you. We are here to come in. We can do an education program within your company. We can provide resources to you as HR professionals so that you can support your workforce. We want to be here for you to support your workforce. But the 1-800 number is a great offering. We have master's level clinicians available in over 170 languages, again, very inclusive. And then we as an organization, I just talked about that free education that we offer. We have support groups. And other resources. We're constantly out in the community, just building awareness, as Ron said earlier. That is really our mission, is to build awareness in the community so people know that they're not on this journey alone. The last thing mentioned on this slide is Trial Match. Anybody can participate in a trial. And if you go to Trial Match, you can find trials that even target healthy individuals, right? They want to talk to people and study people who perhaps have a family impact, but they aren't having any symptoms. They want to understand why, right? And so there's just thousands of trials where trial participants are needed. I highly encourage you to visit Trial Match, which is on our website. It's alz.org/trial match. I'm going to I'll just add it in there, /trial match. And our website is alz.org, and you can find all of the information that you need on our website anytime. So I do think this is another good place for me to pause. I'm happy to pause and see if there's any questions about how we can partner with your companies, or any additional information regarding treatment or testing that we didn't answer yet. Okay. Again, feel free to just stick your hand up or ask any question in the chat, and we'll make sure to get your questions answered. So I talked a little bit about what we've accomplished through advocacy at the Alzheimer's Association and the fact that we are the largest nonprofit funder of research, but the US government is the largest funder of research, which is awesome. So through our efforts from an advocacy perspective at the federal level, we have impacted research, as you can see, from 560 million back in 2014 now to 3.8 billion in 2024. And, we were on Capitol Hill last week, and even with all of the uncertainties that we're having with the new administration coming on board and there's questioning around NIH funding, we still asked for more money. Our legislators were surprised by that, but we're not going to stop. We're not going to slow down. Now is when we need to be leaning in. So we do have a request for an additional 113.5 million, and we hope that Congress will approve our request going into this next session. We're also looking at access to testing, right? So we talked about that blood biomarker that has just been recently approved by the FDA. When that blood test becomes more widely accepted, because it does come with some complications, right? I think, we don't necessarily want you to go and get that blood test at your annual visit, right? If you're going, you go and get your cholesterol checked, and, they're checking all of your panels, and that's not the time, if you don't have symptoms yet, to be getting this blood test, because the physicians are not going to be able to translate the information that they receive in result to those tests to the individual who's getting tested. Unless you're going to a specialist or a researcher, they will 100% be able to translate that information to you. And so then there's concerns. Is that going to lead to anxiety and depression and things like that if there are these blood tests that are showing some markers, but you're not 100% likely to get Alzheimer's or dementia? They're not definitive. They are definitive when confirming a PET scan and a spinal tap. Those are the two ways to identify amyloid and tau currently. And then these blood biomarkers are about 96% accurate to confirm those test results and to be used by a specialist. Does that make sense? So that is one of the things, but we want to make sure that when these tests and when these new treatments are available, that they're covered by Medicare and they're covered by our private payers. And so we were on Capitol Hill asking for that pathway for approval through our ASAP Act. And then we're also lobbying and advocating for continued grants to go to providers so that they can get additional information on how to diagnose Alzheimer's. Not everybody has access to a center of excellence or a memory center like we do right here at Vanderbilt, but guys, Vanderbilt has about a year waiting list. So if you're trying to get diagnosed for Alzheimer's and you've got to wait a year to get diagnosed, you're going to progress pretty quickly in that year. And maybe you're no longer eligible for treatment, because those treatments we talked about earlier are targeting the disease at the earlier stage. So the earlier we can get diagnosed, the better. And we need to make sure that nobody's waiting to be diagnosed by one of these local centers of excellence. So advocacy plays an important role at the federal level, but also here at the state level. I'm actually the chairman for the Alzheimer's and related dementia Tennessee Advisory Council. It's the governor's council that it was legislatively created in 2019. And this council is looking at what are those infrastructures that we have here in Tennessee, and how do we support our state plan to enhance offerings for caregivers or for those living with the disease. One example is that recently the Commissioner of Health asked for funding for dementia care navigators to be located at the local county health department. So if you receive a diagnosis, you can go to your local county health department and meet with a dementia care navigator, and they can help you identify what services are in your local community that can help support you on your journey. We can do that as well, but they do that at a more specific county level. We are a little bit more broad. We do have some resources on our community resource finder, but those dementia care navigators are something that we're putting in place here at the state level. We also have a respite care program that was piloted for 3 years, that was legislatively created and is implemented by our area agencies on aging and disability. That's a part of the Tennessee Department of Disability and Aging, and that respite care program provides some important downtime for those caregivers who need that additional support. And we're so proud to have had that legislation be unanimously voted in here in the state of Tennessee. So advocacy plays an important role in a lot of what we do, and we hope that you'll get involved. Maybe you've heard about the local Walk to End Alzheimer's. We have 10 walks across the state of Tennessee. I have them listed here. Nashville is the 5th largest walk in the whole country. So please come out on November 8th, be a part of the Nashville Walk to End Alzheimer's, form a team. We'd love to have you. If you're not here in the Nashville area, we do have others in the surrounding Middle Tennessee, Clarksville, Rutherford County, and Tullahoma. But if you're even further across the state, we do have walks across the state. And I'll leave this URL right here, alz.org/Tennessee Walk. I can actually put that as well in the chat if I can find the chat box again. There we go. So alz.org, Tennessee Walk. We hope that you'll join us. And then I talked about the longest day here. That's our other signature campaign. That's actually coming up this Saturday. The longest day is the day with the most light, and it's the day we fight. It's the day when we kind of shine the light on the challenges that come along with Alzheimer's and related dementia. We want to honor those who are caregivers now or who have been caregivers in the past. And of course, we want to honor our loved ones who are in this fight on the journey. And then we also want to honor our loved ones who we have lost in this fight. So you can get involved by visiting act.alz.org, and you can find both information about the walk and the longest day. But here's that Tennessee URL for Tennessee Walks. And then we hope that you'll join us in, become an advocate. We do Day on the Hill every February. We'd love to have you come out and join us if you have a personal connection to the disease. We hope that you'll offer education within your company. If any of you want to get in touch with me, Ron, are you okay if I put my contact information in the chat?
Yes, that's great.
Okay, great. Please email me. I would love to hear from you. We would love to come and do an education program within your company. We offer quite a few different programs, not just what I did today in terms of awareness. This is more of an awareness opportunity, but we also have programming around the 10 warning signs about understanding Alzheimer's dementia. We have healthy habits for the brain and body. We have an empowered caregiver series, so a number of programs that we can offer within your company to show your workforce that you support them on this journey. And then, we talked a little bit about Trial Match. Get involved if that's something that is interesting to you, and we'd love for you to come out and join us at the walk. Any extra questions today? Any additional questions? Please don't feel shy. I'm happy to answer anything. All right. Well, thank you so much for having me today. I'm so grateful to be here.
Hey, Dawn, I had a question.
Yeah.
Sure.
Just curious if there's any key milestones that families should consider when they're thinking about the hard task of knowing when to move a loved one outside of their home.
Yeah. So that's a really good question, Krista. Listen, the beginning of this journey is really, really, really hard. Listen, I have a team of 37 people that work for me, but I called that helpline 5 different times. You know, for me, what was great about the helpline is I could talk to them about things that, and they could give me advice that, and then they would follow up with me in writing, and I was able to sort of forward what they would send me to my brother. And so I always felt like my brother and I were on the same page. Krista, every family is different. So, you know, there are some families that keep their loved one in the home all the way to the end, right? And then they bring hospice into the home. When you need help, and one of those milestones you talked about was one that write the car. You know, if you have a loved one that's having challenges with memory, you really want to assess their driving and understand. For us, the early warning sign for my mom was that she got lost coming home from Easter Sunday at my brother's house. She was lost for 5 hours in her car, and it took us 5 hours to find her. And she was embarrassed and she was scared, and thank goodness she didn't, you know, harm anyone or herself. You know, the next thing is phones and computers. You know, my mom was scammed 5 times in 6 months, and we finally just went in, took the phone, took the computer, and walked out and just let her know they were broken and they needed to be fixed, and we never brought them back. And then, of course, you know, when medication management is an important one as well, you might need some help, especially if your parent lives alone, and they're having a hard time managing their medication. That's the most common reason why our loved ones living with this disease end up in the emergency room, because they're not managing their diabetes or their heart disease or their thyroid condition. And so they end up in the emergency room. And for our family, you know, my mom had a fall and she ended up being losing the ability to walk, and she ended up in a wheelchair. And so for us, you know, 24/7 care, though it's not that much less expensive in a memory care facility, which still very expensive, was not something we could do at home. And so I think that led to our decision, but it's really sort of a personal decision for every family. Does that answer your question, Krista?
Yes, I'll call the hotline too. I very much appreciate knowing about that resource.
Absolutely.
Can you speak just a little bit on one point that you mentioned around kind of the connection between diabetes? I'm hearing a lot about this being called type 3 diabetes now.
There is a deep connection, and actually there's a study being done on Ozempic right now, right? Oh goodness, right? Ozempic is going to maybe be that miracle drug. It helps you lose weight, but then it also prevents dementia. You're at a higher risk if you are living with diabetes to, and that it's not being managed properly, to get dementia. But that high risk really comes along with not managing your diabetes properly. I think there's definitely a connection between eating properly definitely a connection between eating properly and dementia, Alzheimer's. You know, there was a study done about processed red meat and 3 servings a week. I know this makes all of us cringe in the South because we eat our bacon and our sausage, but 3 servings a week increases risk by 12%. So food is definitely tied, and so mismanagement of diabetes can also be connected as well as a high risk factor. Any other questions? Great questions, Krista.
Can you speak a little bit about the alternative therapies, supplements, more of a naturopathy approach?
I'm going to put a link in the chat of our sort of landing page. Oh, I know I need to add hold on, I need to share this slide though for Ron. Let me just go back to sharing, and then let me put a link in the chat. I just need to find it. Regarding supplements, because there's a lot of controversy. What I will tell you is that, remember, some supplements are not regulated. And so, you know, I don't recommend sort of one supplement to manage the disease. I don't, you know, I think that diet and those types of things are going to be more impactful. Is that helpful, Krista?
Yes, it's not going to stop me from taking my coconut oil and ginkgo biloba. Yes.
Listen, you do you, like, but I definitely know that, you know, I think I've read a study, and we have promoted a study on vitamin B12. So 100%, like, you want to, you know, take your vitamin B12, but I'm just adding in the link about the supplements so you can read a little bit more about alternative treatments, if that's
Okay,
helpful.
great. Thank you.
Uh-huh. And Ron would love you to use this QR code to share your feedback, and I'll turn it over to Ron. But any more questions for me before I leave you guys today? Thank you so much for having me today. I'm
Yes.
so grateful.
Yes. Thank you so much for coming today. We really appreciate it. And this is great information. For everyone, remember the July in-person SHRM meeting on July 10th at the Holiday Inn Vanderbilt. We look forward to everyone coming out and having a good time with us. And again, thank you for coming in today.
Thank you, everyone. Thanks, Ron, for having me.